Hi, Dr. Paula Sauer here, and today's video is about what do I do if I just sprained my ankle. This comes from one of my Instagram followers who recently sprained her ankle and she needed some guidance. First thing you should think about if you sprained your ankle, most likely if you did, you sprained this part of your ankle on the outer part because you did this with your foot. This is called inversion, and usually when you invert this way, you sprain an ankle ligament called the ATFL ligament, or the anterior talofibular ligament. You don't need to remember that, you just need to know what it hurts right there. Now, if you sprain the inside of the ankle, these exercises and self-care techniques still apply, but this is the most common one, and I can explain on a later anatomy video if you guys are interested. Now, I don't have an ankle sprain, but if you do, you usually have swelling here. You might even have bruising. Depending on how much swelling and bruising you have in this area indicates how bad the sprain is. If you have a lot of swelling and a lot of bruising, it's not a bad idea to go get an x-ray and make sure you didn't break anything in your ankle. So always, if it's a new injury, please go consult with a doctor. Right now, maybe it's telehealth, but it's always a good idea to keep your doctor involved. The first thing you're gonna do is elevate your foot. So I'm on a bolster here. You can lie on your couch and do this, or take a chair in front of you when you're sitting, and you wanna keep your leg elevated. So elevation, or you can even take your leg up a wall and have it up in the air that way. The other thing you're gonna wanna do is put ice. The first 48 hours, you're gonna put ice on this, and you may wanna continue to ice it because it helps feel better, takes the swelling down, takes the inflammation down, and takes the pain away. So ice will be very comforting here. And then you're gonna do really gentle range of motion, meaning you're gonna move your foot. So you're gonna point your toe and then lift your foot up towards your head. So this is plantar flexion, this is dorsiflexion. Notice I'm going slow. If you're in a lot of pain, you just wanna move very slowly and go, well, what can I do here that doesn't hurt? The slower you go, the more you'll be able to do and explore and see what feels safe. So pointing and flexing your toes. Part two is you're gonna scoop your foot in and away just a little bit. This is inversion, this is eversion. Going slow, maybe it feels better if you lift your foot up a little bit more versus pointing your toe. And you wanna make sure you're not twisting your leg through this. You wanna make sure that it's really coming just from the ankle and the rest of your leg is still. And then the last thing is you kind of combine those motions. You do little circles one way, and then little circles the other way. Now, how often and how many of these you should do? I would do about 5 to 10 in each direction, as long as it doesn't hurt. If it hurts to do circles, maybe you make your circle smaller. Maybe they look like this. Maybe they look really funny and weird. That's okay. Just move it a little bit. This is what we call an open chain exercise because my foot is not on the ground. I'm not standing on my foot. So it's incredibly gentle. It's to get a little fluid exchange, get things moving, get your body and your brain talking to each other again. Okay? And then you would do this in the morning, maybe once in the afternoon, and again in the evening. So 3 times a day, but if you did it once a day, that's fine. We'll just do something. Now, how long is it gonna take for your sprain to heal? Sprains can take a long time to heal. They can take a couple months to heal. And the reason why it takes so long is because ligaments typically don't get a rich blood supply. So things in your body, if they don't get blood, they take a long time to heal because they're not getting that nutrient exchange and things are just stagnant. So blood supply equals a better healing rate and better healing time.
So some people can feel sprains depending on how bad it is. They can feel sprains for several months, up to 3 or 4 months. And it'll feel like a dull ache. And a lot of people will say, well, I still feel it, but it doesn't feel quite right yet. And that's when you know it's still healing. So this video is just for that first phase, that first week to 2 weeks when things are really swollen. If it's not a bad sprain, then maybe it's just a couple days up to a week. These exercises are appropriate. Stay tuned, I'm gonna have the next phase of what you do with an ankle sprain coming up. Thanks so much for joining me. I'm Dr. Paula Sauer. My clinic is Align Physical Therapy. You can find us online at alignptla.com. You can also email me if you have any questions, paula@alignptla.com. You can also leave a comment down below in the comment section, and I will oblige your request. Thanks so much, and I'll see you all soon. Bye.